Okay, so I did a Q&A session yesterday on Instagram and I got a ton of really great questions that I thought would be helpful to tons of you. So I thought I'd record a YouTube video where I can answer all of the questions in a bit more detail than I usually do in my Instagram stories. So let's go ahead and dive into some of the amazing questions that you guys had about your pelvic floor and specifically pelvic floor tightness. And I'm so happy because these questions are a lot more in depth, and I feel like we've graduated as a community from some very basic pelvic floor questions to some more in-depth questions. So let's go ahead and dive in. And if there are any links that I mentioned, I'm going to pop in the notes below so that you can reference those as well. So first question is, and I've got my notes over here, so if you see me looking over here, that's just because I'm looking at my notes. I want to make sure I don't miss anything. So first question is, how do I find if I have a tight pelvic floor or not? I have a posterior prolapse. So first of all, there are some really telltale signs that give us some clues as to whether or not we're dealing with pelvic floor tightness or pelvic floor weakness. Now, keep in mind that tightness and weakness are not completely separate from each other. So if the pelvic floor is tight, usually that tightness has come about because it was weak in the first place. And in a nutshell, let's say, for example, take the hamstrings as a really good example. When the hamstrings are tight, right? So let's say you can't touch your toes and you're stretching and stretching and stretching and stretching, and it just doesn't seem to get any better. That's because at the root of the tightness issue is weakness. So if you've ever noticed when you strengthen your hamstrings, if you've ever noticed if you started adding in things like deadlifts and other hamstring strengthening exercises, all of a sudden you miraculously get more flexible in your hamstrings. So if you've ever wanted to touch your toes, yes, it's helpful to stretch the hamstrings. Yes, we need movement in order to be able to strengthen those hamstrings in the first place, but ultimately we need to strengthen. So when we talk about pelvic floor release, we're talking about it in the context of just getting us to the point where we can strengthen. So anyway, I digress because the telltale signs, there are 6 really common symptoms of pelvic floor tightness. Those 6 symptoms, super common, are frequent urination, urge incontinence. So that feeling where you put the key in the front door and all of a sudden you don't know if you're going to make it in time, right? Urge incontinence. I call them phantom UTIs because they feel almost exactly like a UTI, but there's no infection present. And it feels like that burning pain, right? But it's actually, if there's no infection present, it's pelvic floor tightness, almost always. So I call it a phantom UTI because it's not a real UTI. Painful penetration. So painful sex, difficulty inserting tampons, difficulty with pap smears, penetration of any kind, painful pooping. So painful penetration of any kind. That's number 4. Tailbone pain. So tailbone pain. That tailbone pain usually radiates to the low back, but tailbone pain specifically because when the pelvic floor is tight, it pulls the tailbone under. And then the 6th and final one is constipation. So which kind of goes along with the painful penetration. Painful going in, painful going out. So those are the 6 really common telltale signs of a tight pelvic floor. Now, a weak pelvic floor, you'll often experience things like leaking. So leaking when you sneeze, which is different from frequent urination or urge incontinence. It's a different kind of leaking. So leaking when you run, jump, sneeze, cough, those kinds of things. Prolapse is also a symptom of a weak pelvic floor. But keep in mind that just because you have a prolapse doesn't mean that your pelvic floor is only weak. Very often there's tightness there as well. And so it's really important that we are able to resolve that tightness before we start working on the strengthening that's going to help with the prolapse. So leaking, prolapse, very often a diastasis. So if you've got, it's a pressure management issue, right? But if you notice bulging of the midline, mosquito, sorry, mosquito, I don't want to get bitten. So where were we? Leaking, prolapse, diastasis, and very often herniated discs. And I'm going to explain this in more detail in a different video because there are connections between all of those weakness symptoms. And I'm going to do a deeper dive on that. But basically, when someone says, how do I find if I have a tight pelvic floor or not? I usually look at the symptoms. Now, another really great way to get a diagnosis is to go see a pelvic floor physical therapist. They can diagnose you, they can do an internal examination and tell you exactly whether or not we're dealing with pelvic floor tightness or pelvic floor weakness. However, these are really common symptoms that give us some really great clues as to whether or not we're dealing with just weakness or weakness and tightness. Okay. So, next question, how long does it take to fix an overly tight pelvic floor with consistent exercises for a complex pelvic floor dysfunction? Okay, so I get a lot of women who reach out to me and they say, I've been doing pelvic floor release exercises for a year and nothing is improving. And the first question I always ask is, have you added in any strengthening exercises? In my personal teaching opinion, and when I'm working with people one to one, usually 3 to 5 days of consistent consecutive days. So when I say 3 to 5 days, I don't mean 3 to 5 days of pelvic floor release. I don't mean 1 day a week. So I don't mean 1 day a week for 3 weeks in a row. I mean 3 to 5 consecutive days of pelvic floor release, even with complex pelvic floor dysfunction issues, is usually enough, because keep in mind, when we are trying to resolve pelvic floor tightness, we are not trying to completely resolve it all at once before we start strengthening. We are simply trying to get just a little bit of movement in the pelvic floor muscle so that we can start to strengthen it in addition. Because remember, when we talked about the analogy with the hamstrings, it's never going to fully resolve until we start strengthening in addition. And that's why I say 3 to 5 days consecutive of pelvic floor release is almost always enough to get you started on your strengthening journey. So how long does it take to fix an overly tight pelvic floor? I will also mention with this that it's not like a one and done type of a deal. So when someone says, how long does it take to fix it? Well, it's usually an ongoing journey, because if you're someone who is predisposed to that tightness, it's probably going to keep coming back. Now, that doesn't mean that you're broken or that anything's wrong with you. It just means that we need to be a bit more aware and a bit more proactive with our pelvic floor release. So what that might mean is, it might mean that when you do when you're going into the gym to do your workout, you just spend a couple of minutes doing your pelvic floor release before you do your workout, and maybe a minute or two at the end if you know that that your pelvic floor tends to get quite tight easily. So just know that it's an ongoing process. Like I definitely am predisposed to pelvic floor tightness, and I grab the therapy ball anytime I start to feel those symptoms come back. I grab the therapy ball, I roll on it for a bit, and it goes away. So it's something that it's just the best thing to do, I think, is to build it into your routine. Think of it a bit like brushing your teeth. I don't think it's necessary to be doing it every day, but once you have got to the point where you are no longer really experiencing too many of these symptoms, just build it in once or twice a week, beginning or end of your workout, and just kind of keep it in your ongoing toolbox. I don't think that any of us should ever be expecting that, oh, let's say we do the tight pelvic floor fix program and all of a sudden I'm never in my life ever going to experience pelvic floor tightness again. No, it's going to be something that you're going to add to your toolbox, right? In the same way that when you go into the gym and you start doing your goblet squats to strengthen your glutes, you don't then walk out of the gym and go, 4 weeks later and go, my glutes are really strong now, I don't need to ever do goblet squats again. No, it's now part of your toolbox and you're now going to add that into every workout. It's the same thing with the tight pelvic floor. We now have these tools that we can add into our toolbox, and we just keep pulling them out. We just keep pulling them out on a consistent basis. Okay, why, when I start doing gentle pelvic/hip exercises, why do my symptoms feel worse? So imagine it like this. Imagine if you sprained your ankle and it's been stiff and guarded for weeks. The first time you try to gently move it again, it might feel worse, it might feel tight, it might feel irritated. That doesn't mean you've damaged it or you've gone backwards with your progress. It simply means that the muscles and the ligaments that have been protecting that joint while it's healing are now waking up and learning how to move again. So a tight pelvic floor works in a very similar way. It's been gripping for so long that when you ask it to gently move, it reacts at first, and then it settles as it learns that the movement is safe. So those sensations that you're feeling aren't necessarily, oh no, my symptoms are getting worse. It's simply that you're reconnecting those mind-body connections to the pelvic floor and to the surrounding pelvic area, possibly the hips stabilizing muscles as well, and that you're suddenly feeling more aware of those muscles. It doesn't necessarily mean that that you're injuring yourself or that you're going backwards with your progress. It's actually good progress. It's actually a really good sign that those muscles are now waking up, and it's all part of that process and it's part of that ongoing journey. Another really great analogy is, let's say you've been sitting in a dark room for hours and you flip the light on, and all of a sudden you're like, oh, my eyes, like all of a sudden it just feels really like abrasive to your eyes for a few moments until your eyes adjust. It's a similar thing, right? So the light's not harmful, it's just that your system wasn't used to it. So that's another really great analogy. So when the pelvic floor has been tight for a long time, it's almost like it's been in the dark. And then gentle movement is like turning the light on, and your nervous system feels this increased blood flow, this increased sensation, this increased movement, and it can feel a bit much at first. Yes, it can feel a bit much, but give it a moment, and just like your eyes adjusting to the light in a dark room, allow your pelvic floor and allow the muscles surrounding your pelvis to just take a moment to adjust. Okay, next question. Do any physiotherapists work with tight pelvic floor issues? Yes. You want to specifically be looking for a pelvic floor physical therapist or pelvic floor physiotherapist. And I'm going to put the link in the notes below to help you search for somebody who's specifically trained in pelvic floor physical therapy. And yes, if they're a pelvic floor physical therapist, they will be trained in working with both tight and weak pelvic floor issues. Okay, next question. Can my pelvic floor be damaged after C-section birth? I'm having leakage 10 weeks postpartum. Okay, so what you need to know about C-section is, and birth in general, is it's not always, or I should say, it's not solely the action of birth that creates, I don't like the word damage, but creates injury to the pelvic floor. Okay, it's not only the act of birth that causes injury to the pelvic floor. Pelvic floor dysfunction usually starts during pregnancy. Okay, so we want to be making sure that during pregnancy we're taking care of our pelvic floor. So for the first 36 weeks or so of pregnancy, obviously assuming you were going to go to 40 weeks, you want to be making sure that you are doing pelvic floor strengthening exercises, because the weight of your uterus is putting pressure down on the pelvic floor. So we want to make sure that the pelvic floor is strong during pregnancy. And then the last 4 weeks or so of pregnancy, if you're preparing for a vaginal birth, we want to make sure that the pelvic floor is not only strong, but also now knows how to relax, because the pelvic floor needs to move out of the way in order for baby to push through it. Now, looking back on my own emergency C-section from 10 years ago, I now know, and knowing what I know now about the pelvic floor, I had no idea about pelvic floor release. All I knew was that during pregnancy, I was taught to kegel, 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 squeeze, 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 squeeze. And I now, looking back, realize that my pelvic floor had no clue how to get out of the way. My pelvis was so guarded. And knowing what I know now about all of the tight pelvic floor symptoms that I've experienced over the years, it makes perfect sense to me that my pelvic floor was absolutely nothing is coming through here. So it's no wonder I had a C-section. So during pregnancy, it's super important to make sure that we are both strengthening and learning how to release the pelvic floor. So just because you've had a C-section doesn't mean that you're exempt from pelvic floor issues, because keep in mind the pelvic floor had to do a lot of work during pregnancy to keep the weight of the uterus supported. So that pelvic floor dysfunction, all this to say, that pelvic floor dysfunction can appear during pregnancy and not just as a result of birth. Mosquito. I don't know if I'm ever going to get this mosquito. Sorry. Ridiculous. There's so many mosquitoes right now. Okay, onwards. Why would a man in his 40s have pelvic floor pain? Doctors just shrug him off. This is my biggest pet peeve. If your doctor shrugs you off, find a new doctor. And I don't say that to be mean. I say that because if your doctor is shrugging you off, it's probably because they don't know the answer. And what they really should be saying is, I actually don't know the answer to that, but I'm going to refer you to somebody who does. So there's probably a little bit of ego going on if they're simply shrugging you off because they want to keep you as a patient. What they really should be doing is referring you to someone else. So I think take that into your own hands and go find someone else who does know. Anyone who's shrugging you off, just assume they don't know the answer and go find someone else who does know the answer. Now, on this, why would a man in his 40s have pelvic floor pain? It is a massive misconception that pelvic floor dysfunction is unique to women. Men have pelvic floors too. So, of course, why would men be floating through life with perfect pelvic floors? Because it's not just pregnancy, right, and childbirth and, the things that we associate with pelvic floor dysfunction. Those aren't the only things that cause pelvic floor dysfunction. Pelvic floor dysfunction can also be caused by things like stress, sitting all day, doing heavy workouts without knowing how to correctly manage the pressure in your core. So there are lots of things that can cause pelvic floor dysfunction, not just pregnancy related. So yes, it's very, very common for men to have pelvic floor dysfunction issues. They're probably less likely to talk about it than women, but essentially the symptoms that I mentioned at the beginning of this video are very similar to male pelvic floor dysfunction. I actually did a blog post about this. So if you go to thebromleymethod.com/blog and search men, you're probably going to find the blog post that I wrote about men. Actually, it was a blog post about it's not just women that experience pelvic floor dysfunction, and it explains it in a bit more detail, but essentially most of the symptoms are the same / very similar. The main difference is that instead of painful penetration in men, it will cause erectile dysfunction or ED. So that's the main thing to keep in mind about men with pelvic floor pain. And also, if that's someone in your life, please encourage them to use the link that I'm going to put below to help them find a pelvic floor PT so that they can seek the help that they need with those issues. Okay. And how many more questions? We've got 2 more questions. Okay. Can generalized vulvar discomfort be pelvic floor related? No infection present, no skin issues. Okay, so the pelvic floor muscles sit right above the vulva, and when the pelvic floor is tight or guarding, it can irritate the nerves and tissues around the vulva and cause sensations like burning, pressure, and discomfort. So when there's no infection, no skin condition, no visible inflammation, no tear or injury, then pelvic floor tightness becomes the #1 suspect. So many women get handed endless rounds of antibiotics, antifungals, steroid creams, when the real issue is actually muscular and nervous system related. So yes, vulvar discomfort can absolutely be pelvic floor related, and release work, in addition to calming the nervous system, often makes a huge difference with this. And the other question I would want to be asking is, are you under or over 40? And this makes a big difference because during perimenopause, which, by the way, the average age for menopause is 51, but perimenopause can start 10 years previously. So if you're on track for that average of 51, your symptoms can start at 41, but it's the average is 51, but it can range anywhere from 45 to 55. So if you're on track for menopause at 45, your symptoms can start as early as 35, right? So I would want to know, are you over or under 40 because during perimenopause, blood flow to the pelvic floor decreases and pelvic floor tissues lose elasticity. So the pelvic floor responds to this by becoming chronically tight. And in this, if this is the instance, so if you're over 40 and you're experiencing pelvic floor tightness issues, just keep in mind that vaginal estrogen can be a really helpful tool in addition to pelvic floor release. So just keep that in mind. Age, is a factor as to how we treat the pelvic floor overall. Okay, final question. Is that the final question? Yes, final question. My pelvic floor physical therapist told me that I have a piece broken off of my tailbone. Could this be the cause? And then the question got cut off. I'm assuming that meant, could this be the cause of pelvic floor tightness? Yes. An injury to the tailbone, I talk about this a lot on Instagram. An injury to the tailbone can absolutely cause the pelvic floor to tighten. The pelvic floor muscles directly attach to the coccyx, and I've shown this a whole bunch on the pelvic floor model. The pelvic floor attaches to the pubic bone in the front, the coccyx in the back, and it attaches to the insides of your sitting bones. So it covers quite a large area. When the pelvic floor is tight, it literally pulls the coccyx under. So when the tailbone is misaligned or has an old fracture, the muscles around it often stay in a protective or clenched state. This is a very well understood pattern, and releasing the pelvic floor and improving coccyx mobility usually helps a lot. If you've worked consistently on pelvic floor release and your symptoms are not improving at all, then it's usually reasonable to talk to your doctor about getting imaging done. Not everyone needs an MRI, but because persistent coccyx symptoms don't respond to pelvic floor release, it deserves a closer look. So usually the tailbone moves, right? So the tailbone is almost like a little separate piece. It's the very base of the spine. It's like a separate, almost like vertebrae, right? It moves back and forth. It's supposed to move. Okay, so it's very difficult, I think, without getting imaging done to know whether or not there is specifically a fracture there, or if there's like a piece that's come loose without getting imaging done. But I think it's safe to say if your pelvic floor symptoms don't respond to consistent pelvic floor release, then I think it's probably a good idea to get some imaging done just to make sure, see if there's anything else going on there that needs to be addressed. Okay, so hope that was helpful. I hope that has kind of helped you to get more clarity around pelvic floor dysfunction, pelvic floor issues, pelvic floor tightness. As I said, I'm going to pop those links below. I'm going to pop the link to the Find a PT. This is going to be super helpful if you are in the US. If you are not in the US, I actually don't have the link to help you find a pelvic floor physiotherapist. But if you are not in the US and you know what that link is, will you do me a huge favor and comment in the comments below and let the rest of us know how to go and find those people outside of the US? That would be super helpful. And stay tuned to the YouTube page. I'm going to be posting, hopefully my goal in 2026 is to post a lot more on YouTube. So do stay tuned and keep your questions coming. These were great questions. Let's do another Q&A soon. And thank you to everyone who submitted the questions on Instagram, and I'll see you in the next video.